Good morning. And
Morning.
tell me your name.
Paula Schneer.
Tell me your story, if you would, please.
I will. Beginning in the middle 80s, I started having jaw popping and sought treatment because my family got tired of hearing it pop during dinner and during meals. The first dentist I went to put braces on my teeth and lots of rubber bands hooking the tops and the bottoms together to try to draw the bite. I wore those for a year, and then I wore a mouthpiece at night to try to hold that position once the braces were taken off. That didn't work. We moved to Kansas, and I found a new dentist who, when I asked questions about my jaw popping, refused to answer them. He just ignored the subject and changed the subject. So then I found another dentist who was interested in TMJ. His methods, however, were so conservative that I went to him for probably 6 or 7 years with no improvement in the jaw popping and periodical locking, not very often.
What was done for you by the doctor, the second doctor, the TMJ doctor?
Basically, I would sit in the chair and I would click my teeth together while I had little red and black greasy papers in there so that he could see where the jaw was aligning or not aligning. And sometimes he would file a little bit on my teeth, but it never resulted in my bite becoming any better or any more stable. My husband, watching TV late at night, found you, Dr. Rahman, and suggested I come here, so I did probably now 3 years ago. We went through a lot of testing, some of it somewhat lengthy for the experiences I'd had in the past, but I ultimately chose to have my teeth bonded in order to solidify my bite. My jaw hasn't popped since.
May I ask you, before you decided that you're going to have porcelain bonded to your teeth, what was done first? Wasn't something done first as a 3 months worth?
Yes, you gave me all of the options that I could have, and we did put some temporaries on.
It's a fixed orthotic. It was on your lower teeth, wasn't it?
Yes, it was on my lower teeth, and I actually was comfortable. It worked. The jaw popping ceased, so I decided to take the full jump and go ahead and get the bonding done.
But you had the option then, because it was done in a reversible way. We could have taken that off if you didn't feel like it was helping you.
Yes, and I did contemplate that long and hard before I went ahead with the process. But for that main reason, and a little cosmetic, I guess, if I were to be honest, reasons, I chose to go ahead and do that.
Okay. And this was about 3 years ago when we finished the treatment.
I think so.
How have things been since that time?
Well, as I said, my jaw has not popped at all.
You had some other symptoms as well, right?
Well, I had suffered from headaches, which I think sometimes were due to the stress and of all of what was going on in my mouth. I couldn't eat hard or chewy foods because my jaw would just actually wear out. It would begin to hurt and kind of spasm. This is, before we started this last treatment.
How are things now in the last 3 years?
Oh, perfect. I don't experience any of the stress. My headaches are better. It's just been a 180 turnaround from what I experienced for so many years.
Okay. Would you mind looking at that statement that is there? And you read it earlier. And would you read the title for me, just the top title?
AADR TMD Policy Statement Revision.
Okay. And there was one particular part on the bottom that you didn't particularly care for. That I highlighted that one, I think.
Yes,
would you please read that one?
Studies of the natural history of many TMDs suggest that they tend to improve or resolve over time. And as I said, this started, I acknowledged it in 1985. And so this is 2010.
Do you think it may have been before that? You said you acknowledged this in 85. Maybe you had it prior to that?
Oh, I'm sure I did. But that's when my family just said, Mom, you've got to have something done about that jaw popping because it's annoying to us while we share dinner together. And so that's when I formally started trying to fix it.
Okay.
So that's been how many years? And up until I saw you and we ultimately have progressed over this last 3 years, nothing was improving.
Okay. So what would you tell folks that are in a position to evaluate the statement, not the people that wrote it necessarily? What would you tell them about making that statement as the standard of care for all dentists?
I think you can't make a flat statement like that about anyone. We're all different. We have different situations. I think people need to seek out a dentist they feel comfortable with, one who they can agree upon treatment with, who follows their line of thinking, and then they can make an ultimate decision. I don't think you can just make a flat statement that applies to everyone.
So, well, if I understand you correctly, you feel like it is ultimately the patients are the people that make the decisions, not a group of dentists telling what they should, all the other dentists should be able to do.
Of course, I would hope that in all of our everyday lives, we make our own decisions about everything, and that includes dental work.
Thank you so much.
You're welcome.